You are most welcome, ladies and gentlemen, to your power behind the voice on Tuesday Night Anatomy with Daniel Okwan. Today's section, I take you through the clear-cut distinction between two kinds of knees which are clinically described. And my friends, these are the clergyman's knee and of course the housemaid's knee. Yes, oftentimes because these two groups of individuals, yes, tend to kneel, yes, and then do most of their works, yes, what happens is that, yes, there could be some kind of inflammation to, of course, some kind of BC, which are fluid-filled sacs, okay, which are supposed to minimize the friction around the area. My friends, importantly, we are talking about the knee joints, and there are some important fluid-filled, yes, sacs which we are going to see. And my friends, importantly, one thing is that oftentimes if there's a clinical case, yes, students tend to find it a bit difficult trying to distinguish between, of course, the clergyman's knee and of course the housemaid's knee, because yes, they have some kind of close resemblance in there. And so without wasting my time, let's set the ball rolling, looking at what I have for you today regarding the distinction between the clergyman's knee and of course the housemaid's knee. Yes, so there we are. If you look at this one that I have over here, yes, this is of course a hemisection trying to show you, yes, taking a lateral view to look at some BC of the knee joint. Okay, so one thing that we have to just look at, the important landmark that we have to look at is of course the kneecap. And oftentimes we know that anatomically the kneecap is something that we refer to as the patella. And so if I look at the patella as my landmark, then whenever I go above the patella, it becomes a suprapatellar, region. And over here in the area of the suprapatellar region, yes, at the lower portion of what we call the distal aspect of the shaft of the femur, anteriorly, yes, we will see one of the bursae. And my friends, the name of this bursa, yes, it makes sense, above the patella, and so we call the suprapatellar bursa. One of those fluid-filled sacs that we find over here, okay, which of course, yes, it will find itself deep to, of course, something that we call the quadriceps, tendon. And my friends, with respect to the patella itself, yes, we will see that there will be another one which appears in front of the patella. So once it comes in front of the patella, then my friends, we'll be calling it a prepatellar bursa, another fluid-filled sac over here where you're supposed to minimize friction as far as the knee joint is concerned. My friends, that's not all. When I go inferior or below to the patella, I go to the infrapatellar region. And my friends, over here we identify two kinds of these bursae. Yes, I mean these ones, yeah, we call them, group of them, we call them infrapatellar bursae. But my friend, we identify two of them. One of them will come, yes, mainly in front of what we call the patellar tendon or the patellar ligament. And my friend, that is why it becomes the superficial part of the patellar bursa, or yes, one of those guys that we find over there. And then we have another one which comes deep to, of course, the patellar tendon or the patellar ligament, yes, over here. And that is why it becomes the deep part of what we call the infrapatellar bursa or the deep infrapatellar bursa. Okay, so these are the things that we see over here. But my friend, there's one more, bursa that I want to show you. Yes, these are the things that I've been talking about. We talked about the suprapatellar bursa. Yes, prepatellar bursa, that's what I've shown you. And then, of course, we also talked about the infrapatellar bursa, which we say we did identify two kinds. We have the superficial one, which comes in front of what we call the patellar ligament, and the one will come deep to, of course, the patellar ligament. But my friends, one more, yes, bio of the bursa, which finds itself in what we call the, pes anserinus group of muscles. Those muscles whose tendon will be inserting, yes, in the upper, middle aspect of what we call the shaft of the tibia. Yes, we know that these pes anserinus muscles, which we also call them the gyros muscles. And my friends, you know them already. We talk about, yes, the muscle which will come from the anterior compartment of the thigh. Yes, we talk about what we call the sartorius muscle. Yes, from the medial compartment of the thigh, we talk about the gracilis muscle. And of course, from the posterior compartment of the hamstring group of muscles, yes, of the thigh, we talk about the semitendinosus muscle. Yes, those ones, they will be separated by another bursa. And my friend, that bursa is something that is given an eponym, the answering bursa. Okay, so that is what we find over here. Okay, so all these bursae, they are fluid-filled sacs which are supposed to, yes, minimize friction as far as, yes, the territory of the knee joint, yes, is concerned. And so that's the other bursa. And so what we are trying to say is that if this bursae, yes, if the friction is too much, if there's that kind of injurious agent, okay, which is chronically exposed to it, then what will happen is that there could be inflammation of these bursae. Yes, it could happen to, of course, the suprapatellar bursa. Yes, it could also happen to something that we call the prepatellar bursa. And my friends, as far as this meeting is concerned, I am interested in this prepatellar bursa, which I'll be taking my time on it, okay, to talk about it. If it gets inflamed, yes, because of course, chronically getting it exposed to, of course, some kind of obstacle, okay, then that is something that we describe as the housemaid's knee. Housemaid's knee. So I want you to understand that whenever we talk about the housemaid's knees, we are talking because the person will be, yes, the obstacle will be hitting all over here in front of this patella itself. Then we are calling it prepatellar bursitis. Okay, so I want you to understand this. And so prepatellar bursitis is the purpose for this meeting, that inflammation, okay, chronic use, okay, of this, exposure of this bursa, okay, against the floor. In the case of the housemaid, yes, doing the cleaning in the household, then it's going to lead to this kind of inflammation. Okay, so I want you to understand that. And then, yes, of course, we have the pes and serenos over there. I don't have a problem. I'm interested in the other parts of this meeting, okay, and that is, of course, the clergyman's knee. And with the clergyman's knee, I am not interested in the deep part of the infrapatellar bursa, because the one which should be exposed more to, of course, the stress will be, of course, the superficial part which comes in front of what you call the patellar ligament. And that one, yes, that inflammation of the superficial infrapatellar, yes, bursa, okay, leading to that bursitis, is the one that we'll be calling it the clergyman's knee. And I want you to understand that. And so what are we talking about? Yes, if you look at these two images, yes, it clearly tells you whatever we are talking about. As far as the housemaid's knee is concerned, we are interested in, of course, the A point over here, okay, just the bursa which is in front of the patella itself, the prepatellar, bursitis, okay, chronic exposure to it, okay, is the one who is going to lead to this, what we are talking about. And so there will be that kind of egg-like swelling, okay, which will happen in front of what we call the patella, yes, in front of the knee joint itself, okay, that's what we're going to see. Okay, and oftentimes I'll be showing you in an image which, yes, you can see it by your surface anatomy, you can visualize it, or you can even palpate to appreciate that this kind of bursitis is actually the housemaid's knee. And my friends, on the other hand, we are talking about this point over here, point B over here, okay, this time around, I'm not talking about a prepatellar bursa, okay, I'm talking this time the clergyman, okay, this time around we are talking about the superficial, okay, infrapatellar bursitis, okay, so chronic exposure of this portion over here to, of course, the floor will lead to that kind of inflammation, okay, in there. That is what we call the clergyman's, knee. And so, my friends, I don't need to explain it further. Yes, the housemaid's, knee, okay, that's what we see, prepatellar bursitis, okay, and so that is what we'll be seeing. You'll be seeing that kind of inflammation, that swelling, okay, that redness, okay, that pain will be experienced in front, okay, of what we call the patella itself. But my friends, if it happens below the patella, okay, the superficial part of the infrapatellar, bursa, then what is going to happen is that becomes the clergyman's, knee. And so, my friends, I believe you find this meeting helpful. Yes, these are the clear-cut distinctions, okay, between what we call the housemaid's knee and, of course, the clergyman's knee. So in your clinical exam, whatever exam, okay, when you are given such a scenario, you should be able to clearly, talk about these things. I'm very grateful for your time this evening. Have a good night, all of you, and may the good Lord richly bless you. Amen.